Welcome, everyone. We'll get started in just a minute here. Going to give folks another minute to join. All right, let's get started. I'm sure a few more will be joining us along the way. Good evening, everyone. Thanks for joining us and welcome to our COVID-19 vaccine for under 5-year-olds town hall. I'm Nick Ibarra. I'm the Communications and Public Relations Officer at the Santa Cruz County Office of Education, and we are co-hosting tonight's town hall with the Public Health Department of Santa Cruz County. Next slide, please. So before I introduce our panelists, I want to quickly go over a few housekeeping items. Tonight's town hall is being recorded, and the recording will be posted on the COE's YouTube channel, along with the slide deck. We also welcome your questions. Please type them at any time in the chat. The questions will be addressed at the end of the presentation, and we'll be monitoring throughout the chat, throughout the presentation. I also want to let everyone know that we are hosting a Spanish town hall, the exact same presentation in Spanish, next Wednesday, July 6th at 6:30 p.m. And the short link for registration is on the slide deck. Next slide, please. So it is my pleasure to introduce tonight's presenters. We will have Dr. Cal Gordon, Santa Cruz County's Deputy Health Officer, as well as a pediatrician. We also have Dr. Faris Sabbah, the Santa Cruz County Superintendent of Schools. And we also have on hand answering questions, Dr. Raelene Walker, who is the Pediatric Director at Santa Cruz Community Health. And all of our presenters, in fact, are members of the Santa Cruz County Pediatric Health Work Group, which includes participants from local healthcare organizations, the County Office of Education, and the County Health Services Agency. Next slide, please. So I want to quickly cover our agenda tonight. We are going to be focusing on several topics, including the approval of vaccines for children under 5, the risk of COVID-19 in children, and some of the particular risks for children under 5, where and how to get the vaccine, the importance of routine doctor visits and routine vaccines besides the COVID-19 vaccine. And then, of course, we will also be taking your questions. Now, thank you again for joining us tonight. And without any further ado, it is my pleasure to introduce our first presenter of the evening, Dr. Cal Gordon.
Thank you very much, Nick. So I appreciate having the opportunity to talk about the under 5 vaccines that are now available since last week. And as a pediatrician, after almost 2.5 years of COVID, I'm really happy that this final group of our population have the opportunity to receive this vaccine. If we can move to the next slide, please. So as people know, we have approval for our under 5-year-old population. And before the approval of the Moderna vaccine, for those between ages 5 and 17, we only had Pfizer vaccine, but we had both approval for Pfizer's vaccine for under 5, as well as Moderna's vaccine from 6 months to 17 years of age. And so the approval process went through the FDA, through the CDC, and then finally through our state Department of Public Health review process, as well as the Western States Safety Review Group, which is comprised of California and a number of Western states. Next slide. I thought I'd first just talk a little bit about each of these vaccines and how they are a bit different. And it is confusing given the fact with the approval processes, and there is some differences between the Moderna vaccine for this population as well as the Pfizer vaccine. The Moderna vaccine comes in doses. For the adults, it's 100 micrograms. For those who are between like 6 to 12, it's at 50 micrograms. And then under 6, it's 25 micrograms. And so basically, for the younger population, is 1/4 of the dosage that the adult population receives. In addition, there are 2 vaccines, 2 doses, and they're to be given at least 28 days apart. They can be given somewhere between 4 weeks to 8 weeks for the second dose. And for the study review process, Moderna had 6,000 plus kids in the age group that were studied. And there was, over the period of time, depending on the age group, the primary virus kind of changed. So you see that the 12 to 17-year-olds was the original and alpha variants. The 6 to 11-year-olds was primarily the Delta variant. And then for the younger population, it was the Omicron variant. And you see the effectiveness for each of these. And so the original, both for the Pfizer and for the Moderna, they were originally based on the original virus. And you can see the effectiveness for actually potentially getting infected with the COVID virus for each of these variant groups. But for all of them, they demonstrated effectiveness for more severe symptoms and for hospitalizations. Next slide. The Pfizer vaccine had on the order of like 4,500 children that were enrolled with the initial review process. And it is actually a 3-dose series. And so the 2 doses are 3 weeks apart. And then there's a 2-month wait for the 3rd dose, so that in total, it could take up to almost 3 months to get the full series completed. For this particular age population, it's the dosage is 3 micrograms, which is approximately or 1/10 of the adult dose, and 1/3 of the 5 to 11-year dose. Next slide. The primary side effects in children that were studied, basically fever, sore arm, general tiredness, headache. There were no deaths. There were very rare side effects that were more significant than the general side effects that you see here. Next slide. So first of all, we understand that for our children, and particularly for our youngest children, we are cautious about providing vaccines, and we know that there are significant people will have questions regarding whether specific questions about the COVID vaccine. So why should we be giving our children vaccines? One, we know that the COVID vaccines will protect our children from getting very sick, and there is a increased protection rate for actually getting an infection. Although we know that with the vaccines, there's still a good chance that your child could get COVID vaccine, but not likely to be as sick. Again, we know that they're effective, preventing against hospitalization and death. And we know that the vaccines are safe, that health experts really were looking at this and took their time for this, in particular for this age group, to make sure that the vaccines were safe. And the messenger RNA vaccines that Moderna and Pfizer are basically have had 20 years worth of research and science that led to the introduction of these particular virus vaccines for the COVID virus. Because there may be questions and because our population is young, we really advise that parents actually talk with your own personal doctors or healthcare provider to review your questions, make sure that they're answered, and that you, after talking, can collectively make a decision about vaccination. You can also see about vaccination availability on myturn.ca.gov, and you can. There are some pharmacies and other sites that will be providing this vaccine. The pharmacists in our county will be providing vaccines only for ages 3 and up. Next slide. So what are the risks of COVID for children? We know that children can catch and spread COVID viruses just like adults. We know that they can infect family members, or such as grandparents, or classmates or community members. And we know that children can get serious complications. I'll provide you some specific examples of that. Next slide. First off, just in terms of historically for our United States population, you can see the curve as to the different original presentation of COVID, the first winter surge, the Delta surge, and then with the Omicron surge, the huge peak and increase in numbers. And then currently where we are. So we're a bit lower than the Delta surge last August, but not by much. Next slide. So we know that COVID increased during the Omicron, just as it did with other ages. We have documented 2.5 million cases of children under 5 who have been reported to have had COVID as of this month. Next slide. And you can see that for children, the infections really mirrors what it has for the entire population. And you can see for the between children less than a year of age and between 1 and 4, that we've had roughly on the order of 2.5 million children, again, for this particular population, have had COVID. And we know that these numbers significantly underestimate the actual infection rate that took place in our country. Next slide. So nationally, about 1 out of every 5 COVID cases was in children. And in our county, it was more on the order of 1 in 4. I don't believe that our children got more infections than the rest of the country. It probably reflects the fact that we were testing more in our county. Next slide. So cumulatively, we had over 13 million cases in children nationally, again, representing about 19% of all the cases. And in our county, we've had over 13,000 cases, representing 25% of all of our cases. Next slide. We also know that with the Omicron variants in particular, we began to see increased case rates and emergency room visits with children. And we know that with Omicron, that we saw 5 times as many children present in the emergency department than the prior waves. Next slide. This particular slide gives you a sense of the between ages 1 and 17, those who actually presented to our emergency department. Next slide. Hospitalization rates, again, were 6 times more increase from the previous variants. Next slide. And you can see again, the peaks with each of these surges, but with Omicron in particular. And what I really want to point out on this slide is the red line, where it's ages 6 to 4 years of age. That's exact the population that we're now have vaccines available. And you can see that there was a very significant hospitalization rate for children, and it increased dramatically with the Omicron surge. Next slide. With children who receive vaccinations, we saw less children percentage-wise with older populations than those who were younger. And if I can show you on the next slide, in terms of ICU and oxygen requirements, and other support, you can see the red graph represents the younger population, and you can see that for this population, they're more at risk for more severe side effects from the COVID vaccine, or from the COVID virus. So if we can move to the next slide. One thing that we've heard sort of bantered about is that basically COVID is just like the flu in children. Well, we know for a fact that more children have died from COVID in the past 2.5 years than significantly than we've seen in the past 3 years for flu. And that if we can move to the next slide, you can see again, we've had 1,200, I think most recently it's actually now 1,400 pediatric deaths in the past 2.5 years of COVID. Whereas with the flu, you can see that in general, it's been about 200 per flu season the past years that were reported in terms of flu deaths. So you can see that, again, COVID has been far deadlier for our pediatric population. Next slide. I wanted to share this slide with you. Hepatitis A, chickenpox, pneumococcus, we have vaccines for these, and these are traditional vaccines that we give to our children before they enter school. And these vaccines, in terms of the year before the vaccines were actually offered, had far less hospitalization rates than what we've seen with COVID. So we feel comfortable, I believe, for the most part. Parents feel comfortable providing these common pediatric vaccines to our children. And I'd like to point out that there is at least as good reason to give our children the COVID vaccine as it is for these prior vaccines that we routinely give our children. Next slide. In addition, I think most people have heard about a particular syndrome that occurs in children where the children typically can do quite well with the initial infection with COVID, but then in a 4, 5, 6 week time period after the initial infection can develop a very serious side effects from the COVID, where they get a hyperimmune response and they can have multiple organ systems affected and can potentially lead to death. And we've seen this occur in at least 8,000 pediatric admissions for the multicystic inflammatory syndrome. And for children under 5, they actually account for roughly a quarter of these pediatric admissions. Next slide. We can see fast heart rate, fast breathing, shock, respiratory distress, heart problems where you have an inflammation of the blood vessels, You can have seizures, you can have severe abdominal discomfort, dehydration, and liver or kidney problems, as well as bleeding problems. And so this is very much a pediatric emergency, and although very rare, can be life-changing or deadly. Next slide. This slide actually shows you the kind of percentage based on age groups as to which populations and had this multi-system inflammatory syndrome during this period of time over the past 2.5 years. Next slide. In addition, we know that long COVID can occur in children where the symptoms can persist, as well as in adults. Next slide. And there can be fatigue, there can be neurologic problems, difficulty with concentration, as well as long-term other complications, to the point that there is a NIH, National Institute of Health project, that's including a number of academic centers and medical centers to look at the effects of long COVID in children. And so we'll be learning more about this over the next year or two. Next slide. So in summary, young children do get COVID, they can usually children can do quite well, but there are children who get quite sick and require visits to the emergency department or hospitalization, and there can be serious complications in our children, and that the vaccines for COVID can protect against these more serious consequences. Next slide. And we also know that with COVID, that there's more likelihood that our children will get infected. We also know that that people, if children, even if they have gotten COVID, that if they're vaccinated, they will have a much stronger immune response for future infections. So with COVID, we know that there can be significant impact, not just on the children, but on our families and the general well-being of our children. Next slide. And I would say again that if at this point, it's strongly recommended that you have this discussion with your physician, talk to them about your questions, and I would say also to consider seeing your pediatrician with your children, just to address your other vaccination needs. During the COVID, a number of families sort of put off their visits with their doctors. And this is a good opportunity to get back and on track just for general well care for your children. Next slide. And I think that's my part. Will be happy to respond to questions as we go into that point of our presentation.
Thanks, Dr. Gordon. My name is Faris, Sabbah. I'm the County Superintendent of Schools. And I'm going to talk to you a little bit about some other health-related issues and ideas to help protect your children, and especially as we think about them returning to school at the beginning of the next school year. We'll have that. Let's go to the next slide, please. But looking at our, getting vaccination on time for both the routine immunizations and also the COVID-19 vaccination is really important, because it helps provide immunity before children are exposed to serious disease, as was explained by Dr. Gordon. And children can safely receive other vaccinations the same day that they receive the COVID-19 vaccine. It's a question we often get from our parents about, is it okay for them to get other vaccines or immunizations when they're getting their COVID-19 vaccination? And the answer is yes. During the pandemic, we found that a growing number of students are not up to date with their immunizations, and these are required for enrollment in school. And so we ask all of our parents to check the vaccination immunization of their kids, make sure that they schedule follow-up appointments with their doctors as needed. It's important to be caught up because if you're not able to get caught up with your immunizations, then you may not be able to enroll your children in school. And we don't want that. We want our kids in school, and we want to make sure that they're able to stay healthy and make sure that our community is healthy. And that requires everybody to do their part to get immunized. And so it's important also to note that some immunizations, just like the COVID-19 vaccination, require follow-up shots. And so it's important to complete the series that your doctor prescribes for you when it comes to getting all your immunizations, your children's immunizations. Can I have the next slide, please? As we as we start thinking about beginning of school in August, we know that summertime is really a good time to visit your doctor. Routine doctor visits are really important, and I just had my kids just went to their pediatrician. We talked about their growth. We talked about any concerns. I was able to get my questions asked. My children asked questions of the doctor, and were able to get ideas about things like nutrition. One of the things that we've seen is, for example, is that there has been an increase in childhood obesity during the pandemic, and doctors are able to give us recommendations of how much exercise children should get, how many portions of milk they should be drinking every day. And so there's a lot of information that we're able to get and to learn about how to protect our children and our whole family. And so also it's an opportunity for you to get those immunizations and vaccinations, as we've been talking, for illnesses like measles and whooping cough and other serious diseases. Next slide, please. So one of the, as we said earlier, it's important for everybody who is getting their COVID vaccines to also be aware of which age groups are eligible for boosters. And so everyone who is 5 years and older is eligible for a booster. So just the younger groups of students are not yet eligible for boosters, the ones who are under 5. And since one's immunity to COVID-19 can decrease over time, a booster dose is needed to maintain longer protection. And so we want to encourage everybody to maintain optimal immunity against infection from a disease. And that means when it comes to COVID-19 vaccines, they continue to be very effective at providing protection against serious illness from COVID-19. And the data showing that the vaccines effectiveness do reduce over time. So especially for people who are over 65. So boosters are shown to increase the immune response and help prevent against severe illness from COVID-19 infection. So boosters provide more increased protection for new variants of COVID-19. And that's something that it could be a new variant that was a different variant than the one that existed when you got your first vaccination for COVID-19. And so this table shows you the number of boosters that are available for people based on their age. And so if for those are 5 and older, 1 booster. For those, for most adults under 50, 1 booster. Those over 50 can get 2 boosters, and people who are 12 years and older who have a weakened immune system can get 2 boosters, again, to help continue the protection against COVID-19. Next slide, please. So one of the ways that we can help protect our children is to ensure that they have health insurance. And it is something that can be so important if our children get seriously sick and need healthcare. In Santa Cruz County, there's a lot of options that really kind of ensure that that students can qualify for some kind of health insurance, and that this includes students that don't have their papers, who are undocumented. And so there's lots of health insurance options, and one of those is Medi-Cal. And you can learn about being able to be eligible for Medi-Cal by going online to santacruzhumanservices.org. to see if you can qualify, or you can call the 888-421-8080, or you can go to one of these two locations to see if your children can qualify for Medi-Cal. And could I have the next slide, please? If you're a childcare provider, many parents may be coming to you and asking you about vaccination for COVID-19. And so we ask that to please communicate to parents to talk to their doctor. And again, not only when it comes to COVID-19, but it's always great to have a strong relationship with your pediatrician to be able to get your questions answered and be able to get COVID-19 vaccinations as well. And there's some additional information that you could find on the santacruzhealth.org website, and that you could refer folks to. Can I have the next slide, please? So we often get the question of, well, what are the kinds of things what are the systems that are in place in our schools and in our community to be able to help keep us safe? And this is what we call the Swiss cheese model. It's different layers of protection. None of them are perfect, so they all have holes in them, because there isn't like a single solution that really can protect us from making sure that we have those smarter steps to protect us completely but together, all of these different components work together to minimize the risks and the likelihood of getting sick or seriously sick. And so the first one is shots, the vaccinations that we've been talking about, wearing masks, especially indoors. They're strongly recommended by the California Department of Public Health. Lots of folks don't necessarily require it, but by choosing to mask yourself and your children, you're helping to increase their protection and decrease the risks. Always having good ventilation, as much outdoor space, as much outdoor air as possible. Having conversations and meetings outdoors is always less risky. Also, taking tests. There's lots of available tests that you can take at home, and also at a variety of different locations. You're able to get tested on an ongoing basis if you have symptoms, if you have been exposed, or if you just want to know and want to get tested every once in a while. It's free and it's available to you. Of course, if you get sick or test positive, then it's important for people to isolate. And then if you get sick and you talk to a doctor, you may also be able to get treatment. And so, and there's a lot of treatment options now that are available in the community for those who are sick, especially if they're immunocompromised. And so looking at all of these different things that we're doing together, they really provide us with a lot of protection. And as we look to coming back to school, when we're going to be back indoors, we're going to be looking to implement a lot of these for our students and our community to again minimize the risks. We have the next. So we wanted to share with you some great resources. You can go find out from the Santa Cruz Public Health page. There's lots of information about where COVID-19 is in terms of our numbers, and lots of resources that are available. You could learn about testing options also on that santacruzhealth.org. And there's also some information you'll see in the chat, places you can go to get more information, and also about vaccination. So lots of information that's available to you. We encourage you to check out these web pages, because they're going to give you lots of good information. And we will move into our next slide, and we're ready for questions and answers. And so we have two folks who, Dr. Walker and Dr. Gordon, who have been helping us throughout this pandemic and keeping us informed about the most up-to-date information when it comes to COVID-19 and also how to stay safe. And I'm going to turn it over to Nick, who's going to be facilitating this next segment for us.
Thank you, Dr. Sabbah, and thank you, Dr. Gordon. I know that was a lot of information, everyone, so I'm sure we're all soaking it in. Again, the slides and the video will be available for you to review after the presentation on our YouTube channel, so you can always go back and reference it. But if you do have any questions now, please use the Q&A feature and take advantage of being here to ask those questions. No questions too small. Chances are, if something confused you, it's going to confuse or interest to dig into deeper, people watching this later. So, but one I wanted to start with, we had a couple of questions about dosage, and I know, Dr. Gordon, you had a slide on the specific dosage information, but can you just talk about it, the fact that there are different dosages for the under 5 age group, and how can parents know that their child is getting that correct dose?
Again, I don't expect parents to memorize this. So the way we do it, given the fact that there are different dosages depending on the age, the manufacturers have color-coded their vials. So the people who are administering it. And so for Pfizer, if you're under 5 for the vaccines, the top lid is maroon colored. It also will have the specific age in micrograms there on the label. For 5 to 11, it's orange. For 12 through 17, it's purple, and then for 18 and up, it's gray. And so
if I could interrupt, Dr. Gordon, could we go 2 slides forward, and you'll get to see the image of those vials that Dr. Gordon is describing.
This is the Moderna one, and and this
the next one over?
Yes, this one. So you see, it's human error is always possible. So how do we minimize the error? And granted, it is confusing because there's different age groups, and for each of these, again, for 12 and up, at least in the Pfizer, it's the same dosage. From 5 to 11, it's a third less, a third of the older group, and then for the youngest group, it is a 10th of that dosage. So the color coding can allow sort of a safer option there. Then if we go to the previous slide, you see that the colors of the lids are a little bit different, or the same other than the older group, but the actual labels are color coded. So why the manufacturers didn't do the same approach, I don't have a good answer for you, but the labels are color coded. So there's a magenta for the youngest population. And so the people administering are sort of trained to make sure about the age. And there is also a check that occurs for every single vaccination, making sure it's the right patient, it's the right age, the right, you have at least 2 identifiers as to who you're giving this to, and then making sure it's the right medication. So you're checking against that. So that occurs when you draw it up, when you're doing all of those processes. And as parents, I think you can ask that question to the person who's giving the vaccine, so that you can confirm that it is the right dose, the right for your child. But there are sort of safeguards in here to reduce the chances of human error.
Good to know, and thank you, Dr. Walker, for answering those questions in writing in the Q&A feature as well. And another question came up. Is there any concern about limited supply for this vaccine? Will there be enough distributed for all children who wish to be vaccinated, whose parents wish them to be vaccinated? Is there a potential supply issue? There is no supply issue. From all appearances, we will have more than adequate supply. So they've been purchased. They're currently frozen. They'll be distributed, and the good news is in the first week we had pre-orders who were wave 1 and wave 2. That actually occurred very rapidly, very well, and so that all the people who had pre-ordered had their supply of vaccines by mid last week. And then just the routine orders now are being filled and be able to turn around. So we don't anticipate any issues about vaccine supply. Good to know. And while we're waiting for other questions to come in, I want to ask Dr. Sabbah, I want to ask you a common question that has come up throughout this process, and that is questions about a potential vaccine requirement. Will the COVID-19 vaccine be required for enrollment in schools, and just what's the status of that right now?
So there were a couple of bills that were being considered to require COVID-19 vaccination for enrollment. Those bills have been withdrawn at this point, and so there is not a requirement for children to be vaccinated with COVID-19 to be able to enroll in school. But we still are highly encouraging it for everybody in our community. And now that we have vaccines for those under 5, for those children as well, but there is not a requirement for vaccination with COVID-19.
Good to know.
Nick, if I could bring up one common question that I've been asked
Of course.
before. So one question that was raised was around the lower dosage. So is it just as effective, and why are we giving less doses? So I would just say that both vaccine manufacturers approach this with giving the least amount with the desired benefit or effect in terms of a response. And so when we look at response, we look at antibody production, and we look at actual protection from the actual infection, or from hospitalization or more serious consequence. And the remarkable thing about children is that their immune system is really robust. And so they, when they get exposed to a particular virus, they produce much better antibody response than older people do. And so with children, we can give a lesser amount and get as good a response. And so the idea is to give the least amount so you have the least type of reaction and still have an effective response. And what was found with the Pfizer vaccine is when they gave just the 2 vaccines, it didn't give the desired effect that was desired. And so, but with the 3rd dose, that they got the effectiveness that was anticipated. And so it was a matter of trying these on, doing the studies, and seeing which would work most effectively. I'm thinking that the Moderna may be able to get away with just the 2 vaccines because they actually started with a higher dose.
Interesting. And Dr. Gordon, I know you talked about this in the presentation already, but we have another question on safety, and this is a topic that we've been talking about throughout the pandemic. There are anecdotes that can be found of side effects, that are more severe than the ones you listed, or, people hear these stories on social media about more severe side effects, such as myocarditis. Can you just talk more about safety, maybe a little bit about myocarditis, as that's something that does get bandied about? And we had a question come in around, are these vaccines safe? And how do you respond to these anecdotes that spread about these more severe side effects?
Well, I think it's, I think when you go on the internet, you can probably get any sort of information sort of supporting your position. And so I think it's important to go to trusted sources. And, I think the Center for Disease Control, the CDC, FDA, the California Department of Public Health have really vetted this. There have been lots and lots of studies. I think we've done hundreds and thousands of studies on COVID at this point. For the older populations, millions of doses have been given, and so we have much more robust data on this in terms of the effects. For these vaccines, the messenger RNA, Moderna and Pfizer, for a particular population of older children, primarily adolescents and young adults, there was rare effective myocarditis, which is an inflammation of the heart muscle. All of the myocarditis from the vaccines, which although very rare, did not have any deaths and there were some hospitalizations, but there was a rapid recovery. With a COVID infection, there was also myocarditis, which and much more severe myocarditis that with complications. So the COVID virus itself can cause myocarditis and was significantly more. There were higher major adverse outcomes from the myocarditis in that group. So for the population, this was primarily in males, and for this population and the 5 to 11, we did not see myocarditis associated with the vaccines at all. And it's thought that because the children had not gone through puberty, and it seems to be associated with pubertal changes and young adulthood, and primarily in males.
That's certainly good to hear. And I guess maybe to put a finer point on it, I think people will be interested to know, how would you advise, family members with children in that age group? What kind of endorsement would you give to them, and would you advise them to get this vaccine?
I have advised my family members, as now grandchildren, as opposed to children at this point. I have adult children, that I highly advise it. As a pediatrician, early in my career, I had children die from 2 different types of bacteria, Haemophilus and pneumococcus. And when the vaccines came out, I never saw the meningitis that occurred from these 2 bacteria. I think earlier on with polio, there have been lots of different types of infections that have affected our pediatric population. And I think vaccines have been one of the gifts that our generation has, and that it offers an additional layer, probably our most effective layer against COVID virus. And the COVID is here to stay. Our vaccines may change to be more directed to the particular strains in the future, but they are extremely important layer. And I think that when you look at risks and benefits, I think the benefits far outweigh the risk associated with it. And I have no reservation at all in terms of recommending them to the general public, but primarily to my own family members and friends and family.
Thanks. That's certainly good to hear. And you'd also talked about vaccine availability, and you did as well, Dr. Sabbah. But I got one question about this via DM, and I'm wondering if you could talk more about this, because it is a little bit different, the approach here, right? We're seeing fewer mass vaccination clinics, and we're encouraging parents to bring their children to their pediatrician's office or to other community-based health clinics. And why is that the case? Why is this a little bit different? And could you just expand more on how parents can take that first step to get this vaccine?
Well, first off, there is a limit in terms of the pharmacies. Our pharmacies have been a major part of offering vaccines in different communities, but there's a restriction on the pharmacists, so it's age 3 and up. But secondly, because of the young age, because the parents running questions, it was really, I think, a shift, not just locally in our public health department, but at a state level, even nationally, that it was decided that having our traditional medical models provide this vaccination for our most vulnerable, youngest population made a lot of sense. And so I think, I think we know for a fact that a fair percentage of parents have made up their mind one way or the other. Those people really on vaccines will be able to find the vaccines, but there's a fair number of people that have opted to wait and would like a little bit more information or see how this progresses. And so having those conversations with a trusted physician that has a relationship with the parents and the families makes 100% sense. So I would say if people can inquire with their personal physicians and see about the availability of vaccines in their offices. We do have My Turn website that people can go to that will also list out availability of vaccines in the community.
Awesome, thank you. And folks, for those in attendance, just want to let you know we're probably going to be wrapping up here a little bit early. If you don't have any more questions, so if you have questions that you'd like to get answered tonight, please, now is the time. You can use the Q&A feature to ask those. And I want to ask one other question to you, Dr. Sabbah, about what other resources are available through our school-based testing and vaccine programs. What does that look like this summer, and can community members, parents, teachers, staff still get tested and get vaccinated?
Absolutely. We've, in our partnership with Inspire Diagnostics and the Public Health Department, we've continued offering testing clinics at the locations at the PVUSD district office, at Cabrillo College, as well as at the County Office of Education. And we'll put the link in the chat so you can see the schedule. There's other locations that are available in addition to the ones that are offered and available through public health. And so anybody in the school community, our students or staff are able to get antigen testing, as well as being able to get the testing that's also available to the community. And so we encourage folks to use the testing, especially right now, because we are seeing high numbers in our community of COVID-19. It's important, when we think of that Swiss cheese model of testing, is an important part of that, is to be aware of if you're positive, if you've been exposed, to get tested. And so we're encouraging families to be able to go to one of these many locations and get tested. They're available 6 days a week. And we also have vaccination clinics available as well. Now, the Inspire vaccination clinics are not available for those under 5. Those, as Dr. Gordon shared, we're encouraging families to talk to the pediatricians. For those who are under 5.
Makes sense. And we had just gotten a question about that. So good to have that clarification. And yeah, I think we're winding down here, but I just want to put it to each of you and give you a chance to share any final thoughts you may have, or other clarifications that may have come up. Dr. Gordon, while we're waiting also for any final questions that come in. Dr. Gordon, anything else that you wanted to add tonight?
One other question that I think is posed is whether we will be treating COVID in the future potentially like the flu vaccine, where it's sort of yearly and targeted at particular strains. And I think that is a very likely prospect for us, and that it will probably be targeted for the most current aspect. And so just as we do with flu, that we're likely to at least have a seasonality to this. The challenge with COVID is that it has sort of continued to change at a rapid pace, and has sort of gone in directions that weren't anticipated. So I think it's fair to say that COVID is here to stay, and that we may have future challenges with COVID. It may be more virulent, it may not be, but I believe that COVID is here, and that vaccines will be part of our protection in the future. We know for a fact that that natural infection alone is not as strong immune response as natural infection with vaccination. And so that we know that, and that if you just weigh natural infection versus vaccination, that the vaccination trumps natural infection in terms of immunity. So this is very much part of our future, and I believe we'll have better vaccines in the future that will be more specific to the particular strain of COVID as it presents.
Makes a lot of sense. And Dr. Sabbah, anything you wanted to emphasize that we've covered tonight?
Just, I think that, as we think about wellness for our children, COVID-19 has really made a lot of challenges bigger for families and for children and for our staff. And so, we know that many children have been experiencing a lot of trauma. And so when we think about wellness, and we think about talking to our pediatricians or talking to somebody at school who could provide some some support, some counseling. I think it's really important that families know that our schools are there to support them, that we are working really hard as a school community to provide as many supports. And we see pediatricians as part of family that are of wraparound services. And so by working together, we can help not only protect our children from COVID-19, we're able to support them as they're experiencing mental health challenges and other maybe medical challenges that they're experiencing. We're seeing also students who have a higher incidence of dental decay during this time. And so by working together and by accessing the resources that are available, we can do everything we can to make sure that our children are healthy and continue learning and thriving in our schools and in our community. And it really takes all of us working together on that.
Hear, hear. Well, thank you both for sharing all of this information tonight. And also thank you so much, Dr. Walker, for answering the written questions. Thank you to our attendees for joining us this evening. Again, this video will be posted in the next couple of days and on the YouTube channel. You'll also be able to find it on the Santa Cruz COE website, santacruzcoe.org, as well as in our weekly newsletter, along with the slide deck. Thanks again for joining us this evening, and have a good night.